Hey everyone, it's a dose of Dr. Drew.
Hey there, everybody. Today on The Dose, we have Open Center, the country's longest-running urban holistic health and education center. The launch of the New Yorkers for New York. It's a free public service for New Yorkers, providing frontline and essential workers, as well as other local residents struggling with stress and anxiety and all the COVID-19 stuff. It's in hopes of, it's time to start focusing on the emotional and mental health and wellness. And right now, we're all feeling it. So this program will offer an array of free tools, resources, services to those working to keep the community healthy and safe and well-nourished. So I'll be speaking to Ross Gettler, the CEO of the Open Center today, about all they have to offer. And we're also going to shine a little light on my daughter's favorite organization in New York, the Urban Resource Center. You've heard me talk about them before. They assist with housing and programs for families. They include your pets, respecting the rights to make informed choices, and reducing barriers to shelter and safety. They focus on domestic violence. And again, your donation will immediately help URI purchase food, personal protective gear, disinfectants. You can find out more at drdrew.com/URINYC. We'll talk to them later. And for the Open Center, their site for, who we're going to hear more about in a second, is opencenter.org/donate-NY4NY. So it's opencenter.org, donate-NY4NY. So let me look at the restream here and welcome all you guys in very quickly.
Hey Drew, would you do me a favor?
Mm-hmm.
Would you turn on the TV behind you?
That would be a great idea. How about that? I'm sort of locked in with
I mean,
this.
I kind of like the dark background, but please, you can turn it on.
I'm locked into these headsets, so I thought I turned everything on.
No. This is
Something
Drew's,
I did not turn on. Here we
Drew's
go.
technological skills.
So let me go back to the restream here. I was thinking today that it's time for us to unite as much as we can, and I feel like you all on restream that come and visit us here give us an opportunity to do that and just to calm ourselves down, join, union, unite. I don't know that right now has any place for the acrimony that we've been seeing for the last many, many years. Let's hope that we can calm that and get through this together. Some quick data. California is doing really good. I was just looking at their hospitalization rate there. We seem to be off by half of what is predicted, even with the graphs being down and to the left. When they reconfigure those graphs, maybe Sunday or Monday, I think you're going to see some remarkably good results in California. For the U.S., I'm hoping to see a drop in the death per day. It looks like we're going in the right direction there, but again, the data will tell as it comes in. We are going to meet our resource demands, but there's a great variability going forward. 17,000 beds, 86,000 beds predicted, but when I look at the data, let me see if I can get that for you. What we're actually at in terms of how well we're doing here, they don't give me the total bed estimate, but it seems to me that what we're going to see this upcoming week is the effect of therapeutics. Doctors are gaining skill with applying various medications for this illness, and it's working. So you're going to see less hospitalization, less ICUs, and hopefully a drop in the death rate. That will be a sign that the physicians are having greater results with the therapeutics that they're using, and there's lots of good results coming in. I've been in touch with people all over the country, and there's enthusiasm. So we think we're seeing good things. And in terms of our staying in place, we're doing a great job, and we should congratulate ourselves. I find it extraordinary that we didn't need an authoritarian government to come in and brick us into our houses. Our local officials, our governors asked us to do this, and we did it on behalf of each other. We just did it. I think that's extraordinary. New York City, let me look at New York very quickly. You guys are asking about that, and then we'll go to our guests in just a second. Because New York is the ground zero. New York is where things got bad. They are on the backside. They are on the downside of their epidemic. Farr's law, what goes up comes down in the same fashion. And I don't have any updated fatality rates yet in New York. It's been around 700-800, and it's been pretty steady there. So let's hope that they can drive that down a little bit. That is where the catastrophe hit. All right, let me bring in from the Open Center. We're going to talk to the CEO. It is the longest running urban holistic health and education center. It's in the epicenter of New York City. Since 1984. They've been at opencenter.org. And Where'd all my information go? Here we go. And I'm welcoming Ross Gettler. Ross, welcome to the program.
Let me turn on.
Hang on.
How you doing, Dr. Drew? Appreciate having me on.
There we got you. So tell me about this toolkit and what people can do with it and what you're trying to do there.
Yeah, first off, again, thank you for having me on. New York City is definitely struggling more than most places around the country and certainly the world. As you mentioned, it's bringing people together, though. People are doing great things right now, and especially in a city like New York where we've had 9/11 and Sandy, and the city is used to banding together. It's just great to see them come so quickly, and it's great to see that spread across the country as well.
It's kind of weird, Ross, too. It's weird that it's happening. 9/11. It was, we came together, and that's what humans do, is they go towards each other. But now everybody's a potential source of transmission. So we're having to find novel ways to get together.
It is a different way. You've got digital gathering going on, and we're going to come out of this in such a different way than we were before. I'm having pretty much daily conversations about that, what it's going to look like on the other side.
So talk to us about the toolkit and what people can get, who should sign up, where should they go, what they're going to get there, that kind of thing.
Yeah, so we spoke with a lot of first responders and people on the front line, and my father's actually a physician, and when I was talking to him about this, he said, Ross, you know what people need the most, and that's time. And he said, you can't give them time, but if you can give them things they can do in a short amount of time, then you're really helping out. Yeah. So our toolkit is mindfulness, anxiety, stress reduction techniques that can be done in a matter of seconds. Even if you're in the bathroom, if you're in the nurse's lounge, if you're in your patrol car, anything you can do really, really quickly and really easily. And the toolkit is designed to have a lot of different methods. As we understand, meditation's great for some people, it's not for others. Breath work may be great for some, not for others. Not everybody likes yoga, some people love it. So we wanted to really have a breadth of offerings that everybody's got something they can do really quickly.
Yeah, a lot of recommendations for just basic breathing kinds of, because that's something anybody can do, in a moment.
Exactly. I did some breath work right before I got on the phone with you.
See how effective that is? You seem not anxious at all. And then tell me about the small groups and the counseling. I'm very interested.
I'm having an anxiety attack.
Okay,
right now.
We're going to coach Susan up on some breathing techniques. It's open.
We'll get to the toolkit right after this.
Mine's all based on cameras not working correctly.
Yeah. So we've got two great partners, Drew. One is a group called NYC COVID Care Network. It was actually started by my executive coach, who's a good friend of mine. We were talking on the phone a few weeks ago. She told me she was launching that. I told her about our idea, and we said, well, let's combine forces. And so what they do is they have gathered over 3,000 volunteers of different therapists and healers of all different modalities. And they are offering free one-on-one and small group therapy and sessions to basically anybody in the city that's on the front lines, even some of their family members that need help. And so I said, okay, we would love to funnel people to your offering because it's amazing. And so we've gathered together, and then we're offering our toolkit to everybody in their network. So that's one partner. Our other partner is a group called Operation Warrior Shield. We've been working with them for almost a year, and they work with veterans, the New York Police Department, and the FDNY. And so we said, well, look, they're taking care of the city in the same and different ways than the people in the hospitals are. So we wanted to share all this value with them as well.
Do you want to refer to those websites as well, or do they get to those through your website?
They can get to this. So the easiest website to get to everything is just www.newyorkersfornewyork.org.
Oh,
we created that website specifically for this. And I should have mentioned that earlier. That's probably the easiest thing to remember, the easiest thing. You can donate through that, which we would love. You can download the toolkit. You can get access to the one-on-one and the small group sessions. It's just newyorkersfornewyork.org.
So is New Yorkers spelled out? Because you have that other...
I put on com, everybody. I'm going to change that. Sorry.
Okay. It's New Yorkers spelled out?
4 with a number 4.
Number 4, New York, yes?
Yes.
Okay.
No. The website is actually all spelled out.
Oh, it
Oh,
is.
then-
Our
FOR.
hashtag is just FOR, exactly.
That
New
wasn't
Yorkers
in your
spelled
information.
out FOR, and then
Sorry.
And .org.
New Yorkers for NewYork.org.
Okay,
Uh,
we're putting it on our
I'm
on
a
our
horrible
stream here.
typer.
New Yorkers for NewYork.org.
Yeah,
Good.
and then for those who want to share on social, we do have a hashtag, and it's just NY, the number 4 NY.
Got it. I'm on the website now. It's great. It looks great. It's easy to navigate. Shows you what to do, how to help. Offerings are straight up front. Tell me about this. Let's see, virtual.
So if people
This is
need
great.
help, they go to that to seek help, right?
Well, let me show you. I'll tell you what's exactly on the homepage.
Exactly.
You get the toolkit for managing stress and anxiety. You get the virtual healing and therapy sessions, and then an on-demand library, and then lots of other helplines and resources. This is great, and a lot of stuff for the frontline workers. So this is terrific. Yeah, I was talking to a first responder from 9/11 a couple days ago on a different podcast, and she said back then the thing that stands out for her most is when people would bring food by because they didn't have time to stop and eat, and so she just remembers the food being brought around and how grateful she was for that. And this is a similar kind of a lifeline.
Yeah, somebody gave us a great tip. We were speaking with a nutritionist, and they said, look, it's great to offer people hour or 2 hour long cooking classes right now on how to cook healthy foods to reduce stress and anxiety. However, what is really helpful for people is just tell them what to bring to lunch at work. Just the foods they can bring that are great to bring in their lunchbox, lunch, dinner, whatever it is. A lot of people don't have time to cook right now. You know, a lot of our frontline workers in the hospitals are also the primary caregiver and their family, and we just understand they've got very limited time.
Yeah, and I appreciate what you guys are doing. How are you? How is everyone? You holding up?
Yeah, thank you for asking. New York is a stressful place right now, but it's a strong place, and we'll definitely get through this. And we're optimistic. We're very optimistic.
Let me ask you
and
this.
We're happy to be helping people.
One of the things that this brought out, which was not a surprise to me, was the economic disparities as it pertains to health and health care in the city. And I would say part of that is living environment, diet, all that stuff. Anybody starting to talk about, more longer term plans to help manage all that?
I would say where I've heard the process now is people are just talking about the disparity. I haven't heard a lot of solutions around it so far. And maybe I'm just not listening in those circles, but it seems the data I'm seeing is our hardest hit communities are the lower income communities.
Oh, for sure.
And at a time.
Yeah.
Yeah.
And I will tell you, let me just offer a suggestion. Because in California, we were just about to start an initiative that I think really would have gotten at this. We have a Surgeon General who understands the impact of adverse childhood experiences, and people that grow up in stressful environments, economically distressed, for instance, have disproportionate amount of adverse childhood experiences. And that leads to, we know for sure there's a direct line to all kinds of medical problems, obesity, hypertension, diabetes, asthma.
Right.
All that is related. So I would humbly say somebody needs to start looking at that issue as well. That would be great.
Agreed.
All right, give us the websites one more time, and I'll at the very end here, I'll because I've got your website up. It's a great website, by the way. I dig it. The websites one more time.
Thank you.
Yeah.
Our web designer will love to hear that. They built this in about 3 days.
They did it. It's really, most of them I look
New
at
York
it.
for New York?
It's New Yorkers for New York, all written out, no spaces.org. And it's really easy to navigate. Yep. And that?
Okay, I'm typing it. If anybody wants to know out there.
It's New Yorkers plural, just to make sure people understand. There's an S on the end of New Yorkers for New York.
And for FOR.
Okay, I typed it right this time.
Great.
I didn't take typing in high school.
And then the other.
And we are a 501c3, so any donation is tax deductible.
Yes.
Perfect. And then the other thing is NY for NY. Is that right?
That's their hashtag.
That's the
Hashtag.
hashtag. Yeah.
And then the other website is opencenter.org. Perfect. All right, my friend. Keep up the good work,
Yeah,
and
you can send your donations to Open Center.
we'll keep pumping it out there. Thank you so much for stopping by.
Great. Appreciate having us on.
Anytime. Let me know how we can help, please. Please. If there's anything else, you let me know, okay?
Thank you.
All right. Okay.
All right.
You got it. Let me go back to the restream. Yes, Christina does have enough TikToks, Tim. So much so that I can't follow them all. Paula wants me to check out a clinical trial, which I'm happy to do. Yeah, I saw that. This is a clinicaltrials.gov. There's a couple arms to this thing. So, yeah, they're trying to put together some good studies quickly, which is great news. I'm happy to see that. There are many, many, many different kinds of studies being done in many different locations, some of them of better quality than others. So keep an eye out for that. There was a study that came out, I've got it right here, just I think yesterday or last night on one of the antiviral medications. Let me see if I can find this for you. This is 2/3 of severe COVID-19 cases improved on remdesivir. And you've heard remdesivir mentioned here and there. It's being used, I've heard mixed results from it, but in the actual formal study, 2/3 improvement. So there is something that could markedly change the course of all this. Wouldn't that be nice? Okay, so back to your restream comments. Let me see what you guys are up to. Yeah, keeping the cloth masks clean, I think is really isn't it just, somebody tell me, is it the washing machine? I think the important thing is that you have multiple masks in rotation so you don't wear them day in and day out. How you clean them it could be Lysol, or it could be, I think, soap and water. I mean, soap really nails this virus, so I would see why not. Let's see. Sherry is asking, how am I today? I am feeling depressed today. I wonder if you all are feeling depressed as well. I had to go out and run and get outside, and again, amazed at how much that helps me. But there's something about the grinding nature of this, a lot of the negativity that's flying around that really can make you feel beaten down. And we are winning with this thing. That's what I want everyone to know. And we need to hang together as we win this. How long we're going to have to stay in some sort of quarantine is,
That's the depressing part.
That's the depressing part. In California, or at least in Los Angeles, we were told another 4 weeks, which seems excessive, but we're all following what our leaders are telling us. It will be very interesting to see if the data in California really shifts down the way I think it might. For if it does, perhaps they'll reconsider that 2 week. Because as I look at the California data right now, we are going down to no cases. I mean, essentially 0 cases, not zero, but nearly 0 by the first week of May. So it's hard to understand why we would then, and if the fatality rate starts to drop off equally, it's hard to understand why we'd have to stay in place for another 2 weeks after that. But again, I don't have the local data. There may be something more going on in LA County. And I do think people are getting a little scared of LA County numbers because they're starting to come up pretty high. Let's take a look at them right now. They were about 5,000 yesterday. Let me see if I can find one for today. I'm sorry, they were at 8,000. Yes, about 8,400 today. So it's kind of slowing down. We'll see. We're doing more testing. We'll see. All right. Now, I'm looking at a tweet. When is this from? From April 10th, from Senator Ron Johnson. Oh, I see. Shouldn't face. There's a tweet that says, doctors shouldn't face disciplinary action for prescribing hydroxychloroquine. I can tell you with my experience that with the COVID, that the doctors are prescribing it quite routinely in some of the milder to moderate cases to excellent result, to people that would have been in real trouble possibly. So let's not practice medicine from partisan perspective or have politicians practicing medicine. That is ridiculous. Okay. Does psoriasis make you more susceptible? It's a good question. I don't know the answer to that. I don't think so. And I'm wondering if you're on already one of the anti-cytokine medications. So that would be another interesting group to study to see if you're less likely to get it, or at least less likely to get the cytokine complications. And acetylcysteine, I don't know what to make of that yet. I see rumblings about it, but I don't have an opinion yet about N-acetylcysteine.
Somebody said you need to smile more.
Well, I'm depressed. So let's try to lift me out of this, and you guys too. I know I can't be alone in feeling this way. This has been going on a long time, and seeing, all the, now like somebody's putting hashtag fire Fauci, and now we're starting to go after people who are trying to navigate, help us, who are really the best people we have. Do not sacrifice and scapegoat the people,
or make it political.
Yeah, the people we should be looking to really do this.
The politics are just terrible.
Well, I don't even know what to make of that, because we have it doesn't even make sense to me to allow your political views enter into this. Just stay focused, and frankly, you should be supporting your local leaders and local politicians to lead the way, because much of these decisions are theirs.
Periscope has the trolls today.
Oh, does it?
Yeah, I didn't have it on, so I couldn't do anything. If
Okay.
anybody wants to take care of that, have at it. That's my new hobby.
All right, let's see. Yeah, Chris, it has become political, and I don't understand what that even means, or why people, why that would be that way. I was listening to David McCraney has a great podcast about cognition. It's called "You Are Not So Smart," and he dedicated it today to all the things that are swirling around people's thinking around COVID and coronavirus. And one of the things the experts were saying was that this was going to create a common enemy and unify everybody. I don't see it. I see it splintering again, so it's not good. Okay, let's go ahead, Susan, and bring in...
He hasn't called yet.
Oh, we're going to talk to Nat Fields from the Urban Resource Center in a minute. They help victims of domestic violence, challenging with safe, secure housing. They have individual and family therapies, allow your pets to come in. Survivors heal there, and they do great work and have been doing it. They're one of the...
I'll show you his picture.
They're one of the the best resources in New York City for a long time.
He said 245, so...
Okay, that's fine. I will keep talking. You can make a deductible to them.
Domestic violence is no joke. So
yeah. You can make a donation to them at drdrew.com/URINYC, the Urban Resource Institute. And then don't forget our friends at the Open Center. Go to their website. The hashtag is NY4NY. The website is spelled out New Yorkers for, FOR, New York, all spelled out .org. Okay.
What time is it?
It's 2:25.
You got to keep talking, honey.
Yeah, I will. I'm looking at the, I don't, Marina, you keep asking me about the Navajo reservation, and I looked around. I could not find any data. I don't know why I can't. Please let me know if there are any websites you want me to check out. No, the ventilator shortage did not happen. In fact, we're going to be sending ventilators to other countries, I'm sure. And here in California, we gave back 500 ventilators to another state that looked like it might get more stress. Is this the camera that's on, by the way? Forgot to ask you.
This one over here.
Oh, I've been looking at the wrong camera the entire way.
That's why you look so sad.
So that may be why I look weird and shifty. I'm looking at the wrong place.
No, we know why you look weird and shifty.
Sorry, but yes, being on Remicade would put you at higher risk. Hashimoto's does not, provided your thyroid is properly managed. Yeah, there's a weird thing happening now where another split is developing, and it is between people that say, hey, we kicked this thing's ass, we did a great job, we locked it down, and we got it, versus people now saying, we went too far, there was never an outbreak in my area, why did I have to lose my job? And that's what I'm fearful about next, is that split and how we keep that healed and together. So, Susan, am I not seeing comments off Periscope? Is that what's happening? Or
it's a slow news day.
Okay. I don't know what that means.
I mean, that
was not an answer to my question.
I mean, it's just, you can't see them? There's plenty.
Okay. Seemingly not. You guys must be doing a good job.
Is your computer on the right Wi-Fi?
Yep. Any specific recommendations for African American communities? Nicole, that is one of my... I am very concerned right now about African American communities, particularly in urban centers, for a lot of reasons. We know that is getting disproportionately hit. I'm worried about what's going to go on in Baltimore. I'm worried about New York City still, and St. Louis, we know that was, and New Orleans too, a major issue. So here's the deal. It's a disparity that does not, that cannot go on, right? We're seeing it now, so it can't go on. It's dietary issues around obesity. It's isolation. It's living environments that are not ventilated and are just exactly, just perfect petri dishes for something like this. It's a lack of trust in the healthcare system because of not being well cared for or being let down in many cases. And then we have the epidemic of adverse childhood experiences that results in many of the mental health and physical health problems in adulthood. We know that if you have 3 or more, particularly 4 or 5 or more adverse childhood experiences, and that includes things like divorce, domestic violence, moving a lot, mental illness in the family, addiction in the family, substance, physical abuse, sexual abuse, neglect, all these things. If you have 3 or 4 of these, your probability of having not just mental health problem, but physical health problems goes through the roof. It gets very high very quickly. So that's all stuff we need to really pay attention to going forward and treat it, and not just say, oh, somebody had adverse childhood experiences, they are at risk. We got to have trauma informed care, and we need more relationship building. So that's Nicole. If you can be an ombudsman, if you could be somebody that helps educate and reach, please reach out. If you have any ideas, I'm open to listen to that. Yes, I have signed up to help, Jason, and I have several patients now in hospital. Thankfully, none are in the ICU presently. Because we never had the surge in California, there's never been they've not called for the extra resources, but I'm still signed up both in New York and Los Angeles. You're worried about carry out. What kind of precautions? Yeah, it's really about just washing your hands when you handle the bag, when you handle the containers, before you handle the food, and get the food away from all that into dishes and whatnot that you have in your home that are clean, and use utensils to move the food about, not your hands, but keep your hands clean. Do I think Seattle will be back to almost normal in June? It's an interesting question. You have a conference. I don't know that there'll be conferences in June, like gatherings of large numbers of people. But Washington, if you go to the website, again, as you know, I go to covid19.healthdata.org. Last time I looked at Washington, they were really on their way out of this thing. We are now on April. Yeah, they're on the downslope. It's a little bit it is slowed a bit, though, in terms of the rate at which the slope is going down. The death per day is going down quickly, and it's still didn't ever go over 42, and it's averaging around 20, which is great. That's going to go to zero-ish around the second week of May. The hospitalization rate, the resource utilization, also first week of May, second week of May is where that really goes down to very, very low numbers. So by June, they are definitely out of the woods. The question is, will they have enough monitoring in place to prevent a recurrence? I hope many of you have read that Apple and Google are both getting together to put things on our phone to help monitor what's going on. Exactly what that's going to look like, I don't know, but I was praying for something like that. That is how we get out of this. Technology and testing. Technology, testing.
Tell your kids to get to work and make some apps.
Corolla, somebody saying, was wondering today why the Los Angeles homeless population was not more affected by COVID. Everybody here is wondering about that. We are very, very thankful that this didn't explode in that population. There are many thoughts. One is that the drug distribution dried up on the streets because the gangs left the streets for fear of getting infected. So the drug distribution went to zero, so people weren't congregating around their drug use.
What?
Caitlin, are you on this thread? I'm getting a text from somebody from Teen Mom, and she's interested in knowing about how to deal with mental health while being told to isolate. Yeah. That'll be my next topic, I promise. Let me just talk about the...
Should I text her your phone number? Let her call?
Or text her...
I don't know if I can. We have to clear it with him.
She can call in on this.
It
She'd be a great subject to talk about this very issue. I would like to talk to her about it.
Yeah, Caitlin or Kaylin?
Caitlin.
Oh, Kaylin. I only have Tyler's number.
Of course.
Well, he set it up the last time.
Let me.
Of course. What do you mean? He set up the last podcast. He was the manager.
Shoot.
I don't know if she can.
She can.
Here, let me send you the number.
No, she can.
Should I send you the number?
No, I'm sending you the number so you can call her. There we go.
Okay.
of course they won't. The number won't show. I'm just going to send you the number. Oh my God, my phone froze now. But anyway, we've
had a lot of weird stuff in here today. It's kind of strange.
We're very fearful that the homeless was going to explode. We're still fearful of that. So there was no congregating around drugs because there were no drugs, and a lot of the homeless folk became willing to go indoors. And our governor has done some great work, and the LA County here particularly has done a phenomenal job of shaking out resources for people to go indoors. And so that seems to have made a difference. And certainly going to the recreational centers and the YMCAs and things has not, they've been screened there and carefully tested and looked at so they're not bringing infection in. So it has been a bullet dodge thus far, but for the grace of God. But for the grace of God. I don't know how we did it, but we have done so. So dealing with chronic mental illness when you're told to isolate, dealing with medical illness when you're told to isolate, these are very, very challenging issues, and people don't give a lot of health to it, a lot of thought to this. So there's no one size fits all for this, right? Because people have varying sorts of treatment interventions underway, some of which you're maybe very, very reliant on. Now, from a medication standpoint, psychiatrists are doing a lot of work through telemedicine. The SAMHSA, which is the federal government's Substance Abuse and Mental Health Services Administration, they have telemedicine available. You should be checking with your doctor, at least do it over the phone, if not actually through a Zoom, some such thing. And if you have therapy, I mean, you can continue that through some sort of electronic media. It's obviously not as effective. It's not as intimate with the close, bodies in space that we prefer to do with the attuned therapies. But you can certainly keep, your therapist can use cognitive behavioral therapies and stay on top of things for you, and also monitor your medication with you. So Susan, any luck getting Caitlin in there?
She said she's watching.
Tell her to come on in, and we will talk to her.
I don't know if she can. I mean, I think it's okay, right?
Yes, it'd be fine.
I mean, anytime they do any video, I have to clear it with MTV.
No, you can bring her up now. You can, believe me. It's fine. We are not going to talk about Caitlin, the teen mom. We're talking about Caitlin as a patient and how she's managing the isolation. I want to talk to a patient, and she's been very, very active in her own care, and so I'm anxious to hear what she's doing and how she's managing it. And she's in a rural area too, which is another issue, that makes it a little different than people say live in an urban center.
Okay, well, we'll see. I'm not going to make her do it if there's no video, so.
Yeah. No, I just wanted her to call in, just like we had the.
Okay, she said she'll call in a second.
Good.
She's got kids up to her eyeballs.
Yes, she does. So. We did a little thing with her. We talked to her, Skype with her last week, and her little daughter was running across the room with scissors. She's like,
don't run with those scissors. Oh, that was so cute. She had this look of concern on her face, and you could just imagine the daughter looking at her like,
Scott, I'm not sure what you're asking about the transferring through packages. I already addressed it about what you do with packages or with food that's brought in. You don't put it in the kitchen. You consider the bags contaminated. Wash your hands after you take everything out of the bags. Then take the food out of the containers, there's no foodborne illness, right? Thus far, no one has contracted this thing from food. Now, wash your hands, wash everything like you normally would, because there's other things you can get from food, but you can get stuff possibly from the containers. And so the key is to keep washing your hands till you get to the point where you have utensils and you're getting the food out onto plates. And then throw everything out and then wash again. What is the invisible enemy, Monkey C? And Nick, tell me what's going on with Joe Rogan. Somebody said he's got something going on. I don't believe anything I read these days.
Is he the next one with his head on a stake?
No, I don't know.
Oh, brother.
I don't know.
Who's next? Hello?
Caitlin?
Oh, wait.
Let's see if we can get her. Caitlin?
Hello?
Or is this maybe...
oh, wait. Let me unmute her.
Hello.
There you are. Hi, Caitlin. How are you?
Sorry.
Good. How are you?
I'm great. You asked a great question, and thanks for watching. So how are you managing? I really think I'll tell him in a second, but I think a patient perspective on this is more important than a doctor sort of talking and waving his hand saying, well, see your psychiatrist, see your therapist, get telemedicine going. What are you doing?
Well, I I've been like Skyping with my psychiatrist.
Good.
But no, I was just wondering like what other things people could do. And I know you mentioned like doing like video chatting with like counselors and stuff like that to continue therapy.
Yeah.
My counselor is actually kind of like older, so she doesn't really do that.
Ooh, that's not
but
good. Interesting.
I've just been noticing like a little bit of a shift of just being like, wow, this is crazy, like having to isolate. How do you deal with that? Like besides going outside or, trying to get sun and stuff like that. But
yeah. And so
just trying to like be on top of it.
So I had a major depressive episode when I was about 19, and so that puts me at risk of a recurrence, right? You're about 50-60% chance of having one again if you've had one. And I definitely have been feeling it lately with all this. And so
Right.
for me, I haven't felt I needed professional help, though I would not resist doing that if I felt I needed it. And oops, my restream just gagged. And what I have found is reaching out to people that you wouldn't, Susan, there's something going on with the restream. There we go. People you would reach out to people that you've wanted to reach out to for a long time, but not, maybe haven't done so in a while. Right. So maybe friends and family and people you've not been connected to. There are tons of support groups out there that you can get involved with. For recovering people, there is a lot of 12-step stuff out there. And I have patients that don't particularly like the meetings that really like these Zoom meetings. They don't like the meetings because they have social anxiety or they feel, but go look around. There's a ton of them. And I have some people that are struggling right now with the substance issue are, go to 3-4 meetings a day on Zoom and they feel like they're getting a lot out of it. I wouldn't have predicted that. So it's not for everybody. And then if you go to SAMHSA, they have telemedicine resources. Go to SAMHSA and look around. It's the Substance Abuse and Mental Health Services Administration, their website, and then the nimh.nih.gov. It's a little more academic-y, but there's a lot of resources in there. So the government gives us a bunch of resources. So it's SAMHSA, SAMHSA.gov. And it's nimh.nih.gov as well. And there's a right up front at the NIMH. It's coronavirus managing anxiety and stress. So you just click on that and
can you give me that website again?
Which one?
The last one you just spelled out.
The nimh.nih.gov.
I was looking at the guy on Twitch saying that I was annoying. Sorry.
And it's.
I am.
No, you're good.
And it's. Go ahead.
I just think it's important. I think it's important for people to be talking about it because I can just notice a slight shift of like when you're told to like isolate and stay home, it's like different. You can kind of tell a shift in your mental health of like not wanting to get dressed or you're tired all the time or stuff like that. So I think it's important for people to kind of watch that.
I 100% agree with you. And sometimes it's just your thinking goes negative or you feel worthless. I mean, how do you feel? I mean, think about it. One of the ways people avoid depression is by engaging or having hope for the future. And we got neither right now. We can't do either. And so it's rough. It is rough, man. So, but you at least have your kids. How are they?
Yeah. Oh, they're doing really good. And I think that helps a ton too, is because they're on schedule. So it keeps you on a schedule somewhat. And like, I haven't noticed that shift yet of like, feeling worthless or anything like that, but you can just sense like a down about kind of feeling, I feel like with everybody.
Yeah.
Even my father struggles with mental health issues and so does my grandma. So mine, I feel like, is genetic, but like you can kind of hear it. Like when I talk to my grandma and my dad, they're kind of sounding like depression is hitting too and stuff. And it's just a wild time right now.
It is. It's so true. And for them, they got a longer haul ahead. I mean, they're going to have to stay isolated probably longer after you do.
Oh no.
Oh yeah, because they're older.
Yeah.
We are too.
We're sort of in that, getting towards that risk area. Yeah. So, well, Caitlin, thanks for calling in. I really appreciate it. I think people, again, having a relatable source of somebody who's honest and talking about their own stuff is way more important than a doctor talking about it, in my humble opinion. So we really appreciate it. I'm sure you.
I know, but I appreciate it. I appreciate you putting out just the web pages and stuff, and I'm gonna definitely look into some of that stuff.
Yeah, and we got to hang together. We got a few more weeks to go, and it's time to start paying attention, not just our physical health, but our mental health. And I know the government is starting to go that direction too, because they know it's going to be an issue. So good for you for bringing awareness and for taking care of yourself, and get some. I've said it repeatedly. The one thing I'm shocked has helped me so far more than anything is sunshine. So get outside if you can.
Which we've had none of here.
Well, today we did. I went out it today, and yeah, it was feel much better.
Good.
All right, Caitlin, talk to you soon, okay?
Thanks, Caitlin.
Thank you.
Say hi to Tyler.
Bye, guys.
Bye. And Butch.
I will.
I miss. Oh, how's Butch in all this? Jesus.
Okay.
Oh, can you tell me?
We don't really talk to him much. I know he messaged a while ago saying when am I going to be able to have family time with you guys? And it's well, not until all this is over with.
Right.
Right.
But we're not super involved with him because we feel like being less involved is better for us.
Yeah.
Emotionally and mentally, you
Yeah.
know, so
Yeah.
not getting too involved with what he's doing on a daily basis. But
Yeah.
so as far as I know, he's back in Michigan, and he's he's a few hours away from us, but
All right.
who knows? I don't know what he's doing.
I think of him often. I love Butch, but I know what you're dealing with there. So do what you got to do to take care of yourself.
Yeah.
Okay.
We'll learn more in August
For
at
sure.
the Teen Mom reunion.
Yeah, I'll learn more then too. All right, Caitlin, talk to you soon.
All right, we'll talk to you soon. Bye, guys.
God
Take
bless
care.
you.
You too.
Bye.
So did you see the Craze Tech mention? He said, Dr. Drew, the Navajo Nation is on total lockdown. Cases of COVID are spreading like wildfire. Look up McKinley Country, New Mexico.
McKinley.
I'll stop spamming. Just wanted to make sure you saw. I don't know. Maybe I said it a few times.
I didn't see it. So I'm glad he.
It is in lockdown in McKinley Country, New Mexico.
Okay, I've got it. They have an official website, but it doesn't tell me much. I'm not seeing much on it.
All the statistics aren't going to go into,
I haven't yet figured out how to get local statistics for people. I'm looking at your county clerk. I'm looking at everything here, and I just am not seeing anything. Let's see, McKinley, Mexico. How about just COVID? See if that comes up.
Paulo said it's not org, Susan. I did it again. Whatever the last website that I put up, it's .com. So it's
Gov.
Gov.
Yeah.
Oh.
Gov.
I don't know which one he's talking about. Oh, well, sorry.
Okay, here's an updated New Mexico story from the 8th. Cases at 865, so not bad. Let's see, McKinley County, they're broken down by county. There are only 15 so there are 15 cases. So you're considered, and there's only one other county that has more cases than McKinley. And so so they will shut you down, like the entire state of California is, and you'll be okay. You'll get through this. Practice some of the things I was just talking to Caitlin about. Okay.
I think the Open Center sounds like a good start if you're in New York.
Oh, absolutely. If you need a place to go and you're in New York. But mostly that's designed for the first responders, though, so I don't want that too much of that pouring in. The Open Center one, at the New Yorkers for New York, there's another site you can go off to that gives you some individual therapies and group therapies and things. So you can look at New Yorkers for New York. Captain,
go on the back of your insurance card and find somebody in your network that you can go see.
Well, not go see, work telemedicine with.
Yeah.
Caitlin, Captain Cuddles, I'm sorry to hear about your mom. The panic attack, I'm suspecting, is more a result of your depression. Some people, I'm one of them, when they get depressed, they get panic. Some people, when they get anxious and panic, they get depressed. It's kind of just a little different biology. And be careful. You can take care of yourself. Grief is a normal thing, but it can be extremely difficult to move through and very, very painful. Gut feeling on solid therapy for COVID. I don't know what that means. Tell me more what you mean, guys. Yeah, no panicking. I mentioned earlier the Dave McCraney, You Are Not So Smart podcast, and in there he was talking to an expert on panic and anxiety, and he said something that I thought was rather astute. He said, there's no situation that panic or anxiety makes better. Never. There's nothing. And he said, no one comes in my office and said, I need to feel more anxious, or I need to feel more anxiety. I need to feel more panic. Now, no anxiety whatsoever is really kind of a cold-bloodedness, and only really psychopaths actually have no anxiety, zero anxiety. So it's normal, of course, to have some anxiety.
Oh, good. I'm not a psychopath.
You have anxiety, and
I was a little worried.
though you have some traits. And so but the anxiety itself, I mean, I think anxiety sometimes can make you be diligent. If some people, some people when they have anxiety, they're sort of on the OCD side of anxiety. It's like they're anxious to make sure they're checking things and anxious to make sure they're doing things properly. That's kind of a productive anxiety. So I disagree with him a little bit that there's no such thing as anxiety making things better, but there's no such thing as panic making things better.
So
that is
our
for
guest
sure.
is on the line.
Oh, good. Let's get him in. Nat?
Wait, hold on. Hello?
Dr. Drew, how are you?
Nat, it's a pleasure to talk to you.
Hi, can you hear me?
We got you loud and clear. Urban Resource Center of New York. Go, give now at urinyc.org or also doctor.com/urinyc. Talk to us about your services.
We do a lot of work with people with developmental disabilities, homeless families, but we're talking today about our work with victims of domestic violence, particularly during this pandemic. You know, URI, we've been in the community for over 40 years, providing those life-saving services to victims of domestic violence. And you know this, Dr. Drew, 2 out of every 3 women who are murdered in the United States are murdered as a result of domestic violence. And a lot of our services, people are leaving their homes in order to seek safety. And that's why I wanted to talk with you today, because during COVID-19, during this pandemic, the worst we've ever seen in our lifetime, our message has been generally stay home and maintain your social distance. But we know victims of domestic violence aren't safe in their homes. And so this is a difficult time. Domestic violence thrives in isolation. So tune in. Think about that person sitting at home because of this pandemic and anxiety is present. But think about that person with very little options being home. So part of our work at Urban Resource Institute is to get the word out to victims of domestic violence that services are available to you. We understand that it must be extremely difficult, but we're here for you during this time of need.
Yeah, the cycle of abuse is such that it isolates the victim. It makes them feel worthless and trapped and unable to have agency to move away. But as I'm sure, Nat, you will agree, the number 1, 2, and 3 priorities are get out, get out, get out, and now you have a place to go.
That's right. And those priorities are harder because, listen, survivors of domestic violence victims are often weighing risk factors. Do I leave? If I leave, how am I going to survive? If I was with someone, they may have been the breadwinner in the family. So if I leave, how I'm going to support myself and often my dependent children. And now we are in a pandemic. So if I leave, am I more at risk to get a virus, get COVID-19? And so in New York City and around the country, we have services available. URI operates generally in New York City. Our units are self-contained units, and we've been partnering with the city, the state, the Department of Health to understand the impact of COVID-19 as best as possible so we can create the safest environment for victims of domestic violence. We want individuals who may be in an abusive relationship, and they are, to know that these services are open and available to them at the Urban Resource Institute.
It must be hugely challenging to deal with the isolating, the social distancing, and get people into good care. It's got to be rough.
It is tough. Listen, our first responders are doing a great job, but I also want to shout out the nonprofit community. This community, I've heard stories from our staff members, the personal sacrifices that they've made being these essential workers to leave their homes, to go to work, to go to domestic violence shelters, to ensure that those shelters are open and operating to provide services for victims of domestic violence, their children, And at URI, interesting enough, we also take in pets. We're the only domestic violence shelter in the city that allows victims to have their pets because we understand that they're part of the family, and often victims won't leave if they are not able to bring their pets along.
That's
particularly more important during this time of crisis because of the unconditional love that pets provide for victims.
So if I knew somebody in this situation, where would I send them?
So if you knew someone in a situation, it's going to be harder to leave. I would say if you know somebody in a situation, first, make sure that they're safe to talk to you. Listen, it's going to be hard if they're staying at home to move away from their abusive partner. So set up some code words, some opportunity that you with them that you know that they're safe to talk to you. Because when somebody's thinking about leave, they're at their highest point of danger, right? Often life and death. And so you want to make sure that they're safe to talk. And you should get on our website at urinyc.org or the National Domestic Violence Hotline, the hotline.org, to look at some of the tips we have on there. You want to be able to send them to the Domestic Violence Hotline, and you can reach that number 24 hours, 7 days a week. You can text them. That number is 1-800-799-7233. They can go straight to the hotline.org where they can chat, and they also have text that love is 22522. And you should talk to them about the availability of those services, but make sure that they're safe to talk, right? That code word could be very helpful, and that resources are available. And if you know somebody, it's good to know some of the tips I'm talking about, that they should find a safe place. They should safely have documents and money if they have to leave, that they have resources to get out and get to one of the safe shelters in New York City and around the country. And above all, and I know I don't have to tell you this, make sure you're not telling them what to do, that you're really listening to them in a non-judgmental way and offering options that you picked up on either the hotline's website that I just gave you or urinyc.org.
I'm on your website, and I love that you highlighted the number of children exposed to trauma that are supported. And I've been talking, lately the public is becoming increasingly aware of the healthcare disparities across the socioeconomic spectrum and people in New York City particularly. And I was saying one of the things that we were beginning to address here in California was the adverse childhood experiences or childhood trauma. That is what results in long-term mental health and medical ill health. Do you feel like that's going to get addressed somewhere as a result of the increasing awareness of the needs?
Listen, I think the ACEs study opened the door for a lot of work. We have a great relationship with NYU where we do a lot of our training to ensure that we're practicing trauma-informed work. But, in shelter, children are often the dominant population. And they left their homes often with their parents to seek safety. They were already in crisis coming to us experiencing trauma. And sometimes new trauma reactivates the old trauma in a pronounced way.
Right.
So part of our work in New York City during this crisis is to understand, and it's a tendency for everybody, that crisis is unsustainable. This anxiety that exists, it's a desire to return to some level of normalcy so you can operate.
Yeah.
And some of the work that we've been doing, particularly when you think about the things that allow for normalcy, like structure, like schools. So when a school shut down, how do you help that young person have those 4 hours where they have more control over their lives and it was taken away?
Yeah.
And so this is part of getting some of those to some of those inequities where a lot of systems and people with more resources, their learning from home took place right away. And for individuals who've left their home to come into shelter, we really have to grapple and work hard with the Department of Education to get access to things like Wi-Fi, get access to things like iPads, to get those students connected to educational resources to build some structure so they can feel a little more control during this crisis period. Tough work when you look at the inequities. Because usually when someone leaves a violent situation, they have less income. And it's harder to get these resources, particularly now in the pandemic. We've been working closely with the city. They've been excellent partners, but this is when you really see the inequities.
I am just so impressed. I'm looking through your website at all the resources and all the community members that are involved and the extraordinary talent that you've got, the deep talent you've got here. Your board of directors looks like an incredible group of human beings. Congratulations on all of this. When I come upon places like this, I always say, if we only could reproduce you 10,000 times, we'd be so much better. There'd be so many people helped. But I'm just so glad you're there doing what you do. I know I know what you're up to. I see it. I get it. It's extraordinary.
Dr. Drew, thank you for that. That's really, really helpful. We can't end domestic violence without a community response. So taking a few minutes just to talk about our work, reach all of your listeners, really a great opportunity for them to go to URINYC.org and learn about the work we're doing to end domestic violence around the country.
And when you go to the website, URINYC.org, there is opportunity to donate right in the upper right-hand corner there. It's available no matter what page you're on. So I hope you'll think of me, Nat, if there's anything I can do to help your organization. This is the kind of, we support a group out here in Los Angeles that is similar. It's more on the educational treatment. It's sort of a therapeutic living environment for kids that are products of trauma. It's not for the whole family. It's really for the kids. But of course, they do lots of family therapies and things. But you remind me of them. And so I'm in New York a lot, hopefully, once we get out of this mess. And if there's stuff we can do, will you please?
We miss it. Yeah,
please include me in whatever it is that I can do. I really dig what you guys are doing. This is the kind of stuff that you know what it does, and you know what is needed. So it affects me, and I want to be a part of it. We do it out here, but we've never had a home base in New York to be a part of. So we would love to do that. Okay.
Oh, thank you so much, and we're gonna get it done.
All right.
I really appreciate you taking the time, and of course, you're so knowledgeable to talk about the work that is being done, and the listeners really knowing that victims of domestic violence are out there. They're in crisis. There are places for them to go, and we want to be able to offer that to them because this is often life and death work.
All right, Nat, I hope we'll talk to you soon, and I'll keep pushing out your website. And again, I'm deadly serious here. I want to do stuff with you guys, so let's figure out how I can help, okay?
We'll get it done.
All right,
Thank you so much.
Take care.
Be safe.
All right, you too. We'll be on the other side of this soon.
All right.
All right, take care of yourself. Okay,
Great. Bye-bye.
All right, buddy, thanks. Okay, so let me go back to now. Somebody, Rob was asking me how come we can graduate nursing students and medical students earlier to work in the hospitals as residents. And then he said, "Why not you?" I am signed up. I'm ready to go. The problem with somebody like me in New York is I have to be relicensed and I have to have staff privileging at whatever hospital they put me in. That is not a minor project. That takes. They're only going to call people like me when they're really in need because I'm not licensed in New York. I'm in California. I'm signed up here in California too to Governor Newsom's group. Whenever they need us, we're ready to go, day or night. We put ourselves on notice that we are happy to be part of the problem. There has not been a surge here, so we've not needed it. Of course, they had the surge in New York, but no one has called me to help with resources yet. But I would happily do so. I'd find a way to get there. When do I foresee our doctors and scientists finding a real solid therapy that works? Hey, Jason Dane, I think next week you're going to hear about therapies that work. I think you're going to see more data on hydroxychloroquine. And as I pointed out earlier, I just have some data here from this study that 2/3 of severe COVID-19 cases improved on remdesivir, which is a very powerful antiviral agent. So that's great news. And then as you remember, if you listened yesterday, I was speaking to that physician talking about how they're managing the so-called cytokine cascade. And my peers are developing a lot of skill with that, a lot of ability with it. Is Gina depressed, Joshua? I'm sorry about that. Will I check Wyoming? Sure, I'll happily check Wyoming. I'm looking at covid19.healthdata.org, which is the University of Washington, Dr. Murray's site that hopefully will be... we'll see some adjustments in the next 2 days or so, which I'm really looking forward to. Only the virus can know where this is going to go. Wyoming is peaking late. They're peaking at May 1st, but they're only going to need about 100 hospitalized cases. Again, my computer is freezing on this website because so many people go to it. It's 3 days to your projected death rate in Wyoming, which is so far 0. 0.00000. So they're thinking around May 1st or so, you may get 2 cases. So Wyoming is really having very little of this right now.
God, Mike. My gun periscope has got to go.
But there's there's an interesting thing. You got to remember the thing about biology and doubling times. It's only in the very last phases of things that really things progress markedly. That's the way, the way things work on an exponential scale is it goes, and then it goes like this. And we're hoping that this becomes a flat little nothing. And that's what we're trying to figure out, if we're there or not. And as Dr. Fauci pointed out, we're usually about 2 weeks behind reality in terms of really knowing where we are. I feel like the fog of war is lifting. The fog of war being the question: are we winning or are we losing this? And we are winning. The two other parts that came out of this, that one I knew would be the case, and the other is I'm impressed that it has been the case, was I knew the medical system in the United States would respond. There's nobody better than us at flexing and meeting the demands and innovating and improvising. Nobody. And look at what's happening. And the treatments are showing to be very effective. Immediately we got on this. The research is underway. Novel approaches are out there, and they're having an effect on hospitalization, ICU use, and of course, death rate. The other thing is how we all responded to this, which I don't think, if you hear Dr. Birx at the White House conferences talk about this, I think she was not expecting this. She was not expecting that when you told people to stay home, that they would stay home. And we did it. Not all of our governors asked us to do this, or our mayors, but some of us did. And those for whom we did it on behalf of one another, not behalf just of ourselves, because we were all well. We just want to be sure we're not exposing others. We're not passing this thing around. And on behalf of each other, we locked it down and should be congratulated, really. And when we go back, we have now Apple and Google working on some technologies that will appear on our phone that will help us track people with this thing, as well as track people who are immune. And we will have more widespread testing, and we will have ways to roll out people that are at limited risk in regions where the epidemiology is suitable. So local epidemiology is going to make a difference. Okay, Susan, I feel like
we got a professor of the Department of Epidemiology at UCLA zooming in on Monday.
Oh, great.
Ask Dr. Drew and
Great.
W. Rimian and Michelle Poe.
Thank you, Michelle. Well done.
So that should be interesting. What does it say here? It says at the Fielding School of Health and Infectious Disease Division at the Geffen School of Medicine.
Great. Fantastic.
UCLA.
I love it.
That's
Go Bruins.
Alma mater.
Not mine. I was the other guys. So
we're a mixed marriage.
Is New York going to be open in May or June? I'm not sure. Not open, but I don't know how New York's going to quite do this. All right, so we will have, we are just glassing, Zombie. Thank you. Italy's still in bad shape? Yeah. No, that will not be New York. Italy was not even a fair comparison to our situation here in the United States. So I don't really want to get into the details, but believe me, Italy was very different than what we're experiencing here. Could we have gotten into problems like Italy? Yeah, I suppose.
In New York.
Yeah, New York was, but even New York was not Italy. So
yeah.
So we'll see. We'll see where it goes. Hopefully the covid19.healthdata.org will have some more graphs for us coming out next few days. I won't have anything new tomorrow that way. Are we doing a show tomorrow?
Yes, we're meeting with Joe Costa of Hillside's organization.
So this is the other group I was talking about that Susan and I have supported for years and years and years, that does therapeutic living and takes care of kids that were in domestic violence or abused themselves.
They have 50 kids in their
living there now.
Living there, yeah. They've been taken care of, and they're all mentally ill kids.
Right.
And he said it's bad enough when they can't go out and do stuff. They're trying to keep it together, but they're doing a great job.
So URI NYC reminded me of these guys. So you'll see tomorrow why I love them, and then we hopefully can do stuff with URI NYC and these.
But they're using a lot of
telemedicine.
Well, with each other, they're keeping in touch with everybody and with their wraparound services. And
good.
So,
well, this talking to Nat,
but he'll explain it better than me.
Talking to Nat Field improved my mood. See, it's something as simple as that. Being inspired
giving
by
back, Drew.
But it's also inspiring. It's really effective giving back. There's giving back, and but there's stuff that really makes a difference, and groups like this really make a difference. So you can go to drdrew.com/URINYC to go to the GoFundMe link, or just go to the did I get rid of their
Open
site?
Center.
No. Go to URINYC.org, and they have a donate site there.
I'm curious.
Yeah.
Would people like to have more of a some of our friends and comedians on again, or I just thought maybe we should be a little bit more serious and not, entertain yet, get some help and get people some help. But
there are a lot of mommies on the line right now, I've noticed. So they're usually hungry for stuff, but they can go to After Dark for that,
I mean, I can have this professor on, and I can also bring in somebody that is
They want Adam back.
well-known.
Request for Adam back.
Oh, somebody wants Adam?
Mm-hmm. Oh, Dr. Oz? We could try to bring on Oz. He's been pretty busy. I kind of try. No Channel 11 tonight. Channel 11 is Monday through Friday.
Actually, he said he would come on.
Okay.
I mean,
let's
his
bring Adam.
publicist did when we ran him into him in New York.
Oz? Yeah. It's different. You get Bert Kreischer back. And Bert's not been on. Has Bert been on this?
No.
That would be
good.
a uplifting. We could just get him on the phone. That's not a bad idea.
Yeah.
Because
why
Bert's
not?
such a positive. What we're all kind of looking for is some more positivity.
Well, he always has funny
Oh,
stuff
you want
to
Dr.
say.
Spaz, Katie? Spaz and I talk every day. So
He's easy. We can get him.
Yeah, so we can get Spaz, we can get Kreischer. Good.
I think Spaz would come over.
I don't make him come. Let's just do it by Skype or something.
Okay. He's not going to be able to do that.
Yeah, how
You
dare
can barely talk on the phone.
Bert's wife, Monique, wants Leanne in here.
We had Leanne, and we just did.
We had Leanne and Christina not like a week ago. So we just did that.
Nobody wants Tom.
Yeah, Tom will be on After Dark a bunch coming up. So
Jim
look for that
Jeffries.
there.
Somebody wants Jim Jeffries back.
We just had
he
that.
was great. He was great.
Jim is kind of locking down again.
Brad Williams wanted to come on.
Okay, Brad can come. Yeah, sure.
Mike Gathwood, I was thinking about him.
What I'm seeing in the thread here is they want diversity. They want variety.
So a little bit of both, a little more fun, and also Bob Forrest.
Bob can come.
I love that you guys love all our guests. Howard Stern, yeah, let's get him.
So.
Tom Arnold wants to come.
Yeah, Tom can be in. We haven't talked to Lonnie Love in a long time. It might be fun to get her on in.
Oh, I know.
Tom Green was just here. We did that.
We did Tom Green. You guys are good at remembering who we. If you haven't seen the shows with all these people, just check out whatever stream you're on and go back in history. You can see these people were on it before. But I mean, I don't mind having them back again. I love all these people.
Sure. Jim Norton, we get Jim maybe. That could be fun.
I think I tried to get hold of him to do the After Dark. I have his phone number now.
Okay, so Jim might be interesting.
So weird to think that. But.
Kimmel's busy. I don't think we can get Kimmel. Monique wants Tom. Tom's not going to be on After Dark a bunch. So
Tom Arnold. He wants to be on with Mangiani, Sophia.
I don't know how they're doing. I mean, she's been tweeting a bunch today, and she's seemed very upbeat. So Nikki Glazer would be great. That's another good one. Nikki and Duncan Trussell. What about? We just had Duncan, didn't we?
Yeah, but we were talking about psychedelics. This was
pre-COVID.
Fog of war.
Okay.
Okay. Well, these are a lot of good ideas.
Okay. Matt Charles asked a really important question, and I want you to listen carefully. That's when he asked, how can you explain hospitalization and intubations dropping if infections are still rising? Low hospitalization, low ICU use, low death, low intubation is all a sign of therapeutics, that the doctors are gaining skill with the therapeutics and they're working. So you're getting people early in the illness, getting treated, they are not progressing. That is exactly what that is a sign of. But, by the way, although the positive rate is still pretty accelerating or pretty high, the hospitalization versus discharge has reversed. The discharge rate is now much higher than the hospitalization rate. So things are going well in New York. I don't want to say very well, but well so far. And again, we can't take our foot off the pedal. Now is the time to keep it pedal to the metal. Okay, we'll wrap things up. Again, let's go over those websites very quickly that I want you to go to donate. opencenter.org/donate-NY4NY, hashtag NY4NY, it's the number 4. Or go to New Yorkers for FOR New York, all one word, .org, and you can donate there. And then the URINYC.org, you can donate, or also at our website, dr.com/URINYC. Really good stuff. And thank you guys for, Tulsi Gabbard would be great. If anybody has a way to get Tulsi Gabbard, I would happily talk to her. Bobby Lee and his wife, that's another good one.
Bobby Lee.
Let's get Bobby on the phone. Okay, guys, thank you for joining.
We'll be back tomorrow at 2:00.
Good. 2 o'clock tomorrow,
I'm just
and
telling
happy
people,
Easter.
I'm not advertising in advance. I'm trying to keep the trolls away. But thank you guys, everybody, for your positive comments and not being, and being there. We love that you're there.
And happy Easter, happy Passover.
Happy
and,
whatever you're doing these days. And okay, we're going to play a Hydrolyte ad just because we love it. And we want you guys to support our sponsors.
And it's a good product. I've been on it forever, and I actually wanted to invent it myself, and they invented it, and so now I'm behind them.
And we'll still be able to see your comments if you want to keep talking.
Okay, we'll watch you.
Mahalo.
See you tomorrow.
We've all been very focused on how to stay healthy these days, but we've not been talking about hydration. If you get coronavirus, flu, or even experience allergies, cold, a variety of everyday ailments, they all need hydration. And that's why it's a perfect time to welcome our friends at Hydrolyte back. This is a great product. You all know I've talked about it for a long time. This was the hydration product I wanted to invent, and they got it there before me. Now remember, dehydration can make you feel sick, even a slight amount, and none of us need that anxiety right now, so stay well hydrated. I am thrilled to welcome our good friends at Hydrolyte back to the show. Longtime fans will remember my obsession with Hydrolyte, which is literally the best hydration product I have found. I'm even more excited to introduce their brand new single-serve powder sticks. Simply pour 1 powder stick into a glass of water. They recommend 7 ounces. The powder dissolves instantly and creates the perfect balance of sodium, glucose, and water to deliver up to 4 times the electrolytes of your typical sports drink. And think about it, you can take this anywhere. You should have it on hand to just pour it into water, and you have a real significant hydration product. The other great news about Hydrolyte, the powder sticks, they are 100% natural, no artificial flavors, colors, or sweeteners, and they are available in flavors like orange and lemonade, and they taste great. Hydration is crucial. Hydrolyte is the fastest and easiest way to stay ahead of it. And you can find Hydrolyte powder sticks in the digestive aisle at Walgreens or Amazon, or simply just go to my website, drdrew.com/Hydrolyte. Again, that is drdrew.com/HYDRALYTE. You see it spelled here. There it is. And you enter the code DRDrew18 to save 30% off your order. Forget the runs on toilet paper. There should be runs on this. This is doing much more for your health than toilet paper. So go get some, have it on hand. If anybody in your family gets sick, you need to keep them hydrated, and that's how you do it.